Blood pressure and hypertension. So, what is blood pressure? Blood pressure is read and recorded as two numbers, systolic blood pressure and diastolic blood pressure. Systolic blood pressure, which would be the top number of the written fraction, represents the amount of pressure exerted on artery walls by your blood during each heartbeat. A normal systolic blood pressure is less than 120 millimeters of mercury. Diastolic blood pressure, which is the bottom number of the fraction, represents the amount of pressure exerted on the artery walls by your blood when the heart is resting. Normal diastolic blood pressure is less than 80 millimeters of mercury. Blood pressure is written as 120 over 80. 120 would be an example of systolic and 80 would be an example of diastolic. So this is a blood pressure chart. It gives you the 5 different categories. So you have normal, which we talked about last slide, which is less than 120 over less than 80. Elevated blood pressure would be 120 to 129 systolic, with diastolic being less than 80. People in the elevated stage are likely to develop high blood pressure unless lifestyle changes are made. Hypertension, or high blood pressure stage 1, systolic ranges from 130 to 139, and diastolic is now 80 to 90. In this stage, doctors will likely prescribe lifestyle changes and may consider placing the individual on blood pressure medication. Hypertension stage 2, systolic is 140 or higher, and diastolic is 90 or above. For this stage, medication is certainly prescribed to control blood pressure in addition to lifestyle changes. The last stage and most critical is hypertensive crisis. Systolic will be higher than 180 and or diastolic pressure will be higher than 120. Readings of this magnitude require immediate medical attention. For hypertension, you have non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors, things that you are unable to change, are family history, age, gender, race, and chronic kidney disease. For family history, if one of your close blood relatives have high blood pressure, there is an increased chance that you will also get high blood pressure as well. As age increases, the chance of developing high blood pressure also increases. Men are more likely to get high blood pressure up until the age of 64. Past this age, women are more likely to get it. Based on race, African Americans are at increased risk. They develop high blood pressure more often than any other race in the United States. Increased risk of high blood pressure can be a result of chronic kidney disease. There are also modifiable risk factors, which are things that can be changed by the individual to prevent high blood pressure. Physical inactivity. A sedentary lifestyle increases the chances of developing high blood pressure. Eating an unhealthy diet, often high in sodium, calories, sugar, saturated fat, or trans fat, all carry increased risk of getting hypertension. On the other hand, eating healthy foods can improve your blood pressure. Overweight and obesity increases risk for hypertension because extra weight places increased strain on the cardiovascular system. Excessive alcohol intake on a regular basis can dramatically increase blood pressure. Other modifiable risk factors are sleep apnea, high cholesterol, diabetes, smoking, and stress. Stress can contribute to high blood pressure itself, but can also lead to these other behaviors on the list that increase the risk even further, such as smoking and poor diet. Common blood pressure medications and their side effects. Calcium channel blockers are used for high blood pressure and angina, which is chest pain. Calcium channel blockers reduce resting and exercise blood pressure and have side effects of post-exercise hypotension, edema, reflux, and tachycardia. Beta blockers are used for high blood pressure, angina, irregular heartbeats, or cardiac heart failure. Side effects of beta blockers is that it blunts heart rate and blood pressure. If you are on beta blockers, make sure your physical therapist or medical staff know. With the side effects of blunting heart rate and blood pressure, it can be hard to monitor if we are working the patient hard enough. ACE inhibitors control blood pressure or reduce cardiac heart failure symptoms. Side effects of ACE inhibitors include orthostatic hypotension upon rising. Vasodilators dilate blood vessels, subsequently reducing blood pressure. Side effects of vasodilators Side effects include increased risk of post-exercise hypotension. Exercise and blood pressure. A normal blood pressure response to exercise would be an increase in systolic blood pressure, and your diastolic blood pressure should remain the same. An abnormal response to exercise would be your systolic blood pressure decreasing or staying the same with increasing exercise intensity, and diastolic blood pressure increasing or decreasing by 20 millimeters of mercury. Exercise can also help lower high blood pressure. It is recommended that you get at least 150 minutes of moderate aerobic activity per week. Example activities include things around the home, such as climbing the stairs, mowing the lawn, gardening, scrubbing the floors, and other household chores. Examples outside the home, jogging, walking, and bicycling. If 30 minutes a day of exercise is too much, you can do 3 10-minute sessions to break it up easier to make sure you achieve your goal of 150 minutes per week. Most importantly, you want to monitor someone who has hypertension when performing exercise. With hypertension, systolic blood pressure is already high at rest, and if not monitored correctly, it could reach dangerous heights with high-intensity exercise. The escalation of uncontrolled hypertension can lead to stroke. The signs of stroke that are important to look out for, we can go over the acronym known as FAST. F stands for face drooping. Ask the individual to smile and look for if their smile is lopsided or uneven on the one side. A stands for arm weakness. Ask the individual to raise their arms above their head. If one arm is unable to raise as high as the other, this is an issue. S stands for speech. Look for if speech is slurred or hard to understand when the person tried to speak. T stands for time. If the person is experiencing or showing any of these symptoms we just talked about, it's time to call 911 and get them to the hospital. We want to remember these signs of stroke and use them to think and act fast. The longer it takes the individual to get to the hospital, the worse the impact of the damage will be. Stroke is when an artery ruptures in the body, and the rupture does not only affect the blood vessel, but the area around the blood vessel and the area supplied by the blood vessel. Stroke can be extremely dangerous, especially if it's located in the brain. It can lead to a host of deficits depending on the location of the event. Examples include hemiparesis, vision deficits, memory deficits, motor deficits, and sensory deficits. Other side effects of uncontrolled hypertension include damage to arteries, narrowed artery aneurysm, damage to the heart, such as coronary artery disease, enlarged left heart and heart failure, damage to the brain, TIA, which is a transient ischemic attack, stroke, dementia, mild cognitive impairment, damage to the kidneys, such as kidney scarring and kidney failure, damage to the eyes, which is nerve damage and fluid buildup under the retina or actual damage to the retina. This slide provides some information about free clinics in the area around Chester, PA, and also dates of stroke support groups offered by Taylor Hospital in Ridley Park, PA. There's about one every month, and the dates are posted here on the slide. And then the links for each website for both the calendar of the stroke support group and the link to get to the website with the list of free clinics is also provided on this slide.